Hello, welcome to the review series in hematology. I'm Dr. John. Today we will discuss relative anemia and relative polycythemia. Relative anemia is most often seen in pregnancy. When women get pregnant, the number of red cells has increased, yet the plasma volume increases even more. Therefore, red cells are diluted. Not only red cells are diluted, so are hemoglobin and hematocrit as well. So now you have decreased hemoglobin, hematocrit, and red blood cells, which does look like anemia. Especially anemia is indeed very common in pregnancy. So the criteria to diagnose anemia in pregnancy is different. The hemoglobin level is lower. Usually without a pregnancy, anemia can be diagnosed in the lab when hemoglobin level is less than 12 grams per deciliter. But with pregnancy, in order to be diagnosed with anemia, that number is decreased to 10.5 gram per deciliter. Here is your take-home question. How do you differentiate relative anemia and true anemia in a pregnant woman? Opposite to relative anemia, there is relative polycythemia. Polycythemia means increased red blood cell count. However, if it is relative, that means it is not a true increase. The actual number of red cells has never increased. It just looks like increased because the plasma volume has decreased. Just like when you have your solution concentrated, you have higher concentration of solutes, but the number of solutes doesn't change. So, what caused decreased plasma volume? Dehydration. What caused dehydration then? Well, you can certainly dehydrate yourself by not drinking for a long period of time, or when you lose too much water, for example, diarrhea, serious vomiting, or profuse sweating. Here is the case. A 23-year-old woman who is at the 23rd week of gestation presents with a complaint of shortness of breath. Laboratory tests reveal the following as the table shows. Now pause this video and study this data for a little while and do the following 5 questions. Have you got all 5 questions right? If yes, give yourself a big applause. If not, just look up your notes, your textbook, or discuss the questions with others. And remember, you can always email me about any question. I thank you very much for your attention.